Each year, more than 200,000 Americans undergo weight loss surgery. 200,000 people looking for a fresh start. The Weight Loss Surgery Channel is the world's first online television network devoted exclusively to the weight loss surgery community. Find the information, support, and guidance that can keep you on the road to success. You'll find it all online, 24 hours a day at the Weight Loss Surgery Channel.
More and more Americans are seeking cosmetic surgery in hopes of improving the rest of their lives. But there has been a growing trend in patients who want work done to improve only one day, their wedding day. Surgeons from Georgia to California are admitting that many patients, men and women, are undergoing procedures to look more attractive as brides and grooms. Interestingly, many of these requests aren't necessarily made with the long term in mind. Dr. Fohad Nahai, past president of the American Society of Aesthetic Plastic Surgery, pointed out during an interview with another media outlet that often people seek cosmetic surgery to simply improve how they look in their wedding photos and how they will look on the beach during those tropical honeymoons. He said patients ask for everything from Botox injections to facelifts, eyelid surgeries, liposuction, tummy tucks, and even full body lifts. Brides-to-be are requesting breast augmentations, and both genders are demanding laser skin therapies. Most of these procedures, of course, require weeks or months of preparation prior to the big day, since the patient needs ample time to recover so they don't walk down the aisle bandaged and bruised. San Diego plastic surgeon Brian Reagan made another alarming revelation. These pre-wedding surgeries aren't always just limited to the bride and groom, but also their parents, aunts, uncles, and even longtime family friends.
I have seen more people presenting with an interest to having surgery before their wedding. And these are both male and female. Examples might be a gentleman who has sustained some injury to his nose and has an unsightly dorsal hump on his nose or crookedness, and he wants to look better in his wedding photos. But you know, the women also come in not only for looking better in their wedding photos, but many weddings are followed by a tropical honeymoon, and they want to look better on the beach. And so you're talking about liposuction or breast augmentation. Timing of your surgery prior to a major event like a wedding is very crucial. It's important that you give yourself time to seek out multiple consultations and to give yourself not only plenty of time to heal when things go as planned, but plastic surgery is not a guarantee. And so you need to give yourself time to do a revision if that's necessary. I tell patients that they should give themselves at least 2 months before the procedures that we've talked about, rhinoplasty or breast augmentation or liposuction. With respect to fillers, again, you can expect a few days of swelling, and you have to take this into consideration. So if somebody comes in the Friday before a Saturday or Sunday wedding, then I tell them that maybe that's not the best thing to do.
Dr. Reagan noted that some patients will start planning their cosmetic surgery up to a year prior to a wedding and get the look they want. Who knows? It might not be too long before couples start adding Botox and lipo to their wedding registries. Finally, as our government leaders debate the need for health care reform, politicians are now discussing the idea of funding the plan through a cosmetic surgery tax. Several economic news reports have revealed that the Fed may impose a 10% excise tax on select plastic surgeries, known as the Bow tax, as a way of helping fund the $1 trillion overhaul plan. The tax, which is currently under review by the Senate Finance Committee, would apply to procedures that are deemed unnecessary for medical purposes. The list includes facelifts, teeth whitening, tummy tucks, Botox injections, and hair transplants, which are always cosmetic in nature rather than offering tangible health benefits. Under Section 213 of the Internal Revenue Service Tax Code, these procedures currently do not qualify as itemized tax deductions when people calculate their medical expenses. It isn't yet known how much national revenue the new excise tax will yield. However, New Jersey has already had a similar tax in place since 2004, which has only generated 25% of the anticipated revenue, according to the American Society of Plastic Surgeons. We spoke with healthcare attorney Michael Bird about the effect a plastic surgery tax would have on the marketplace.
Right now, there's word that they're kicking around a new tax. It would be a tax on elective cosmetic procedures. The media is referring to it as the Bow tax. For the time being, it's something just to follow. There's nothing real pending, but it is something to follow and something to be concerned about because it can have a negative consequence both to the plastic surgeons as well as the patients. The only state that has implemented an elective cosmetic tax has been New Jersey, and it has failed miserably. The revenues they were hoping to generate have not been anywhere close to what they were seeking, and it has been an administrative nightmare. Trying to figure out what types of procedures qualify for the tax or not has been a real nightmare. And the bottom line is if this goes through, it's going to be an increased cost to the patients because I'm certain that will increase the cost of the different procedures. It's a common misconception that the wealthy are the only ones that get cosmetic procedures. There's a lot of data out there that a significant portion of the patients out there that get cosmetic procedures are actually the middle class, and they will be impacted by this as well, and it'll further delay them getting the procedure of their dreams that they've been saving up for.
So far, no bill has officially been brought before the Senate Finance Committee. We will keep you posted as the story develops. Well, that's all the time we have for today. If you have a suggestion for a story you think we should cover, please email us at news@theplasticsurgerychannel.com. I'm Deanne Moore. Thank you so much for joining us, and remember to join us again next week for more plastic surgery news. We'll see you then.